Okay, I think we'll get started here today, folks. So again, thank you for joining us for today's webinar, Care Options, Residential Placement. And as always, super pleased to be co-presenting with Amy Abrams, who is our Director of Education at Alzheimer San Diego. And there's Amy. Glad to have you presenting with me today, Amy. So what we're going to be doing today is covering a lot of information. On our agenda today is to be talking about long-term care and what that means when we use those terms. And then we'll be delving into what residential care options are out there for families. Additionally, and very important for you all to know, is what are the support services available? These are big decisions, and they're expensive, often expensive decisions, and requires a good deal of planning and thought going into it. So we want you to definitely be aware of all the supports that are there for you. Clearly, a good portion of thinking about residential placement is financial considerations. So we will delve into that some as well. And then lastly, we'll talk about the other ancillary resources and supports that are here for all of you folks. I see Kristen is putting out already our main line numbers, so keep that in mind, folks. And let me just say, as we start going into this, understanding long-term care, the decision is highly personal to each and every family, what the right way to do things is, what the right answer is, what the right facility is, what the right environment for my person living with dementia is. It's highly variable and extremely personal. So what we're giving you today is some generalities, okay? There's no one size fits all. So I want you to keep that in mind, and absolutely keep in mind that you do have the option to be able to contact us and have a family meeting with one of our social workers to talk very specifically about your family situation and what might be the best options for you. So keep that in mind, okay? Now, I am going to turn things over here to Amy. And she'll tell you a little bit about long-term care, and we do just want to acknowledge some of this will be a repeat of yesterday's class for some of you who were at yesterday's class. Amy, you're on.
Yes, thank you, Jean. And yes, if you attended or watched a recording of the first part of this two-part series, some of this may be a review for you. So just hang with us for a few minutes, but it is important that we talk about what we call the continuum of long-term care before we get too deep into placement options. So first, I just want to define the term long-term care. What this refers to is, you see it on the screen here, the array of services, supports, care settings that exist to provide people with the assistance with the non-medical sort of basic tasks of daily living. You see here on the screen this, what we refer to as the continuum of long-term care services. It's not necessarily a continuum in that you start with in-home care and then you use adult day services and then you move into residential care. People can drop in and out of the long-term care continuum at any point. The words can be a little bit of a source of confusion. You don't necessarily have to be using long-term care for a long period of time. You may be recovering from an illness or an injury and need some assistance with what are considered custodial tasks. These are shown here on the screen for your information. When we talk about the activities of daily living, the ADLs, this is also referred to as non-medical care. It's also referred to as custodial care. These are the types of services that people who are using long-term care services, long-term care, these are the types of tasks they need help with. either on a temporary basis because they're recovering from something, or on a permanent basis because they're living with a chronic condition, including Alzheimer's disease or another type of dementia. So the ADLs, this is insurance terminology you'll get very familiar with if you're sort of in this world for any length of time. Let me go back to that screen. Okay, so those ADLs are eating, bathing, dressing, transferring, which means moving one's own body from a lying to seated or a seated to standing position, toileting, managing one's own continence, and walking or ambulating, being able to move independently with or without assistance. These are the tasks that when you need help with them, you are said to be receiving long-term care services. So the major thing to be aware of here is that long-term care is not medical care. It is not what we refer to as healthcare. It is healthcare, but strictly, technically speaking, these services are not generally provided by licensed healthcare providers, nurses, physical therapists, doctors, for example. They are provided by professionals. Sometimes they can also be provided by unpaid family members and friends. But when we say long-term care or custodial, we're basically talking about the array of things that are not provided in healthcare settings or healthcare contexts by licensed healthcare providers. So again, here's that sort of spectrum of services. And the first webinar in this series covered the topics of in-home care and adult day programs, as well as other community-based supports. And what we're going to be focusing on here today specifically is residential care, which takes a variety of shapes and sizes and flavors, which Jean will be describing to you. These are anything from small board and care homes to assisted living, apartment complexes to memory care or dementia-specific assisted living apartments, and skilled nursing care. Skilled nursing care is an interesting sort of piece of the puzzle here in that it does kind of straddle the worlds of long-term care and medical care or health care. Because sometimes individuals are, for example, hospitalized due to an illness or an injury. They stay in the hospital for a while and then they discharge to a skilled nursing facility for rehabilitation services, right? There they are receiving medical care. They are undergoing therapies, for example. They're being seen by a doctor. They're being treated by nurses. They are receiving rehab, and that is covered traditionally, usually by Medicare, other types of health insurance because it's medical care. But sometimes people are living in skilled nursing because they're no longer appropriate for this lower level of care, what we call residential care. In that case, we call that a custodial stay or a long-term stay in a skilled nursing facility. And in those contexts, that's considered long-term care. So I hope you can see the difference between those two types of skilled nursing care. They could take place in the same building, in the same room, and in fact, the person could be in the same bed. And today be receiving medical services and tomorrow be considered a long-term or a custodial resident of that skilled nursing facility. Jean will be going through all of these different types of care in more detail here in a moment. The important thing to take away here is that long-term care, because it is not medical care, it is not health care, it is not covered by Medicare and other traditional forms of health insurance. No matter how good your medical care is, right? Medicare and a supplement, TRICARE for life, for example, no matter how good the health insurance plan is, it's for healthcare. It's for medical services that are ordered by a physician. And what we're focusing on here today are long-term care services. We will be talking, after we describe the array of services, we are going to be talking about the various forms of insurance and benefits that are available to help cover the costs of long-term care. But for now, the important takeaway is that these services are not covered by Medicare or health insurance. So it's really good that you're here to be learning about this sort of array of resources and thinking now about what you may need to do to be able to pay for them down the road. So finally, before I turn things over, it's important that we sort of pause, take a step back and ask, right, is it time? Right? These are questions we are faced with often as social workers at Alzheimer's San Diego, as members of the education program in particular, right? I know about home care services, I know about adult day, and I've been researching dementia care communities here in San Diego County, and I just don't know, right, is now the time for me to make that call? Right, that is, of course, a very personal and individual decision. And as Jean mentioned, we're here to walk you through it, right? Our social workers won't give you the green light or the red light. It's ultimately going to be your decision as an individual or as a family, as a care partner, perhaps. But what we can do is guide you through your thinking about sort of where you're at in this spectrum. These are the questions we might ask you to reflect on, right? Is managing my day-to-day becoming harder because of my responsibilities as a caregiver? Do I see, maybe I'm the person living with dementia and I'm becoming aware that the responsibilities, the physical load, the emotional toll of caring for me is starting to take a negative effect. It's starting to have a negative effect on my caregivers, right? Many people make the decision to move into residential care on their own because they can see this is beginning to have an effect on the people around me. It may be that you are a caregiver who's starting to see, you know, I'm not sleeping well anymore. My blood pressure is going up, right? I'm not able to take care of my basic healthcare and well-being needs because of my caregiving responsibilities. If that's the case, it is most definitely time for more help, right? Is it time for placement? Maybe or maybe not, but it's certainly time to bring in some reinforcements. Right? Dementia caregiving is a heavy load. There's just no way around that. This is a long journey for most individuals. There is, of course, the challenge of memory loss and cognitive impairment, but there's also frequently the challenges of changing personalities, behaviors that can be unpredictable, not always necessarily negative, but just different from what we know and expect from this person. And that takes a toll, not only on the person living with dementia, but on their care partners. And so if the person's personal care needs, those activities of daily living are becoming more than a caregiver can manage, or even if it's a matter of personality and behavior challenges, those are legitimate reasons to consider bringing in long-term care assistance or making a move into a residential setting of some type. And finally, we have to consider safety. For many people, it's sort of the basic fact of, you know, the person has become incontinent, for example, and I can't keep them clean and keep their skin safe. They're beginning to wander more often. I'm very worried about them, you know, leaving the house while I'm sleeping. There's more falls. They're beginning to get hurt, or I'm afraid they're going to get hurt around the house. So safety for many people is a big consideration. So as Jean indicated, there is no one sort of moment for most people where we know this now is the time. It is time to consider residential placement. But if you need assistance in sort of walking through these questions and walking through the options, please know that that's what we're here for.
Okay, so we're going to talk a little bit about residential care options now, folks. And we've got a lot of information in this area. So if you've got your pens handy, make some notes. But do remember, we will be emailing the slides out to you as well. Okay, so let's see. This graph is kind of just showing you the different levels of residential care that are out there, the continuum of residential care. And so at the top, we've got some independent communities for seniors. And then below that, you can see we've got residential care facilities for the elderly. And I'll talk more in detail about these things shortly here. And then skilled nursing facilities and continuing care retirement communities. And I want to also just point out, as Amy did earlier, it's not necessarily that you start at the top and you move your way down. I mean, you know, it's just dependent on the circumstances going on in our lives. I might be living in an independent senior community and have a fall and need to go to a skilled nursing facility for rehab and, you know, eventually get my way back to my independent community. So this is just kind of for some guidance for you in terms of what all is out there. So, all right, so the independent living and senior communities, these are the ones, I don't know if any of you still actually get the paper, the newspaper, physically get it, or if you read it digitally, but we see a lot of advertisements in the newspaper for these communities. That's how they advertise themselves as senior living. And there's no special requirement to get into these particular communities. They're not licensed in any way, shape, or form. So that means they're also not providing any level of assistance with those activities of daily living that Amy was talking about. So they're not providing you with different supports in terms of kind of personal care or any of those types of things. What they are providing potentially is, you know, of course, they almost always have landscapers and groundskeepers, so you don't need to worry about any of that stuff. They often have concierge services where you can make arrangements to have dry cleaning picked up and, you know, shopping, groceries delivered, and so on and so forth. And they often have social clubs as well too. I suppose for those that do, they'll be doing less of that right now with the pandemic, but they've got oftentimes some social programs going on as well too. But other than that, you know, they're not licensed. These are really just communities for people usually 55 plus. And I don't know if I want to say that that's senior or elderly, because I'm in that category. But usually that's the age range that they're looking at, is 55 and up living. So our next area here is what we call residential care facilities for the elderly, or RCFEs. And falling under this category are 3 levels of care. And that's not the right way to say it. There's 3 descriptors that we use here in terms of residential care. And that's board and care, assisted living, and dementia or memory care. Now, there's some differences between all 3 of those. They are all licensed by the same regulatory agency. They are all non-medical. Think about how Amy defined non-medical. So we're talking custodial care. So they're not providing, you know, things like wound care or physiotherapy or, you know, administering medications. What they are providing is that custodial care, help with the ADLs, with bathing, with eating, with grooming, toileting, those kinds of things. That's what they're licensed to be able to provide. Now, a board and care is usually a smaller home in the community. And I always say you may have some board and care homes in your own neighborhood. I do. I've got 2 or 3 around me in my neighborhood. So they're private homes that have a license to provide care. And they usually are going to be 4 to 6, maybe 8 residents in the home, depending on the size of the home. And they're usually shared rooms for the residents that are there, but sometimes they'll have a private room as well too. And they are providing this level of care, this custodial care to just help people out with daily living. Cost-wise, these tend to be a little on the lower end of the scale in terms of what it costs. I hesitate to say the word they're cheaper because this is all expensive care, but to just give you a financial range, maybe in the $2,000 to $3,000 or $3,500 range for many board and cares. And you have to really do your research, and that's true of all of these different types of facilities that are out there. And we can give you guidance on how to do that research. We'll talk about it here during today's webinar, but for sure you need to be a proactive consumer here when you're looking at these things. Assisted living. These are the facilities that we see usually maybe in the 30 to maybe 45 resident range. They're not big facilities, but they've got a goodish amount of people. And these facilities are also providing comprehensive custodial care as is needed by people. You can move into an assisted living facility and not need any help, and that's fine. But as things change, maybe if you have a bout with, the flu, not COVID, but the flu, maybe you need a little assistance for several days while you recover, and then you can go back to being independent. So they're able to provide some of that custodial care as is needed. Assisted living facilities, it's important to note, are not locked and secured. So they are not appropriate fits most of the time for people with a diagnosis of some type of memory impairment. And in fact, if there is a diagnosis of Alzheimer's disease, assisted living is not going to be the right fit for that person. Cost range here for assisted living, maybe about $3,500 to start, up to maybe $5,000 or $6,000 per month. This is not inexpensive, folks. Okay, dementia and memory care. This is important. Here's the distinctions of what dementia and memory care can provide to the people that are living there. They are required, again, licensed by all the same licensing agency that all of these different types of facilities are licensed by the same agency. The difference for dementia and memory care is they must have delayed egress, meaning a secure perimeter, so that our people living with dementia, who we know are prone to wandering, are not able to wander off the property or outside of the building, and that's very important. They are also required, although it doesn't specify the staff to resident ratio, it does say in the licensing regulations that they must have enough staff to sufficiently and appropriately meet the needs of the residents. And additionally, they are required to provide some type of dementia training to their staff when they are newly hired, and to all their staff on an annual basis. So dementia training is a part of that picture. Cost-wise, $4,500 a month maybe would be the low end of the scale here, and they can go all the way up $8,000, $9,000, $10,000, $12,000 a month, depending on the level of bells and whistles that they are providing. And so again, that's pretty significant cost there. So those are these three types of facilities that we see that we call residential care facilities for the elderly, RCFEs. All right, and now,
so if I could just interject, I just want to also mention that there is usually, depends on the setting, but there is usually an option to have a private room versus a shared room, and of course that will impact the cost.
Absolutely. And the other thing that I should mention as well too, some of these facilities have kind of do a combination, that they have assisted living and they have dementia and memory care. So that if there is a change in a resident in terms of cognition, the resident, has the potential to be able to move to the dementia care area of the facility. And that is less disruptive for people. The other thing about this is we often have seen the families that contact us, couples moving into these facilities where one person maybe has a dementia diagnosis of some type, so they're in the memory care area, and their spouse who does not have cognitive impairment is in the assisted living. And the nice thing about that is that they are in the same facility and they are able to see each other and be with each other on a daily basis. So skilled nursing facilities. So Amy actually spoke to this really nicely. I liked the way you described that, Amy, how they kind of straddle the worlds of medical care and custodial care. And I think that's about the best explanation or description I've heard of it. So I'm copying your words here, because it is kind of hard to describe and to give people really the essence of what skilled nursing facilities are doing. Now, Amy talked how they provide medical care to people that have maybe been hospitalized for goodness only knows a fall, a broken bone, or an illness, or a stroke, or something has happened. And then they are admitted to a skilled nursing facility for a rehabilitation stay, in which they receive their medical care. And absolutely that does happen. And then again, as Amy mentioned, we do have some folk, and by the way, Amy said that that would be covered by insurance, such as Medicare or other types of insurance, because it's medical care that these folks in rehabilitation are receiving. And then we have some of these other folks that are in a skilled nursing facility because they are needing long-term custodial care. They need a higher level of care 24/7. And it's a higher level of care than what those RCFEs can provide. And so in that instance, we do have some folks that are admitted to and residing in a skilled nursing facility as long-term custodial care. And in those cases, Amy will likely cover this more when she's talking about the financial considerations. But again, to say that that's not in that instance of long-term custodial care, that's not covered by insurance. It is covered by Medi-Cal. And I just want to say for skilled nursing facilities, they are all licensed and regulated by the California Department of Health. And for all of these facilities, we are soon to give you some websites that you can access to get further information on them. And do know that there's lots of that information out there so that you can do your good research. Continuing care retirement communities are kind of their own thing, their own animal. And I think here in San Diego, we have maybe 5 or 6 of them. Does that sound about right, Amy? Yeah. And so these are communities that really are actually offering all these levels of care, different types of facilities and levels of care we've just talked about. So they will have independent communities, and then they will have an assisted living component in the community. And then they will have a memory care component in the community. And they will have a skilled nursing facility on site as well too. And so when folks are looking at and interested in these continuing care retirement communities, we do call them CCRCs. What you need to know, first of all, is that these are it's a very costly option. If you have the dollars that can support that, good for you. They usually have a buy-in amount that you have to buy into the community. And I'm going to give you ballpark figures of maybe $250,000, $300,000 plus to buy in. What's the benefit? Well, you know, if you can move in and have your independent apartment, like a condo, and do your thing, they'll have all sorts of programs and activities for their residents. Then if you have a change in your health status of some kind, maybe developing cognitive troubles or a fall where you break a hip and you need some skilled nursing rehab, you will move in that community into those particular designated areas to receive the care that you need. And if it's rehab for a broken hip, you may soon be back in your independent apartment condo. So the point being is you stay on site, you stay within your community. The one thing I will say that I have heard, from families that have utilized CCRCs and frankly also from elder law attorneys, is that if this is something that is a consideration for you or someone it's really important to read. There's a contract that you are buying into and signing when you purchase this option, and you need to be very careful to read that thoroughly, really thoroughly, because we know contracts, there's often little tricky areas in contracts. So here we go. How do we evaluate residential care? Well, this is where you really need to put on your proactive consumer hat. And, if you're somebody who likes to look at all the specials for Black Friday and or do your budgeting, to see where the best deals are for your grocery shopping each week, you like to coupon any of those things, look at this through that same lens of really, you need to delve into it and give it some time and be thorough and be thoughtful. So absolutely, I'm not going to go through this whole list, but licensing is always a good place to start. This is where you can access the reports that the regulatory agencies that make sure these facilities are operating the way they're supposed to, are writing their reports on how those facilities are doing. So you want to see what those reports are saying. You definitely need to think about where the location is in the county. We've had some families, for a variety of reasons, have chosen a facility that's actually not geographically close to them, but otherwise has ticked all the boxes and has been the best choice for their family members. So, you need to look at those things as well too. Clearly the costs are a part of the whole thing you're looking at. And you do want to look at the physical facility itself, what it's looking like. And let me just say quickly that all the pretty decor in the world doesn't necessarily translate into good care. So don't be too moved one way or the other, whether a facility is really, really pretty or, you don't want it to be far on the other side. But look, there's some facilities out there that are just kind of plain. They don't have all the pretty things, but they provide really good care. Most important to be looking at that quality of care. And so all of these things, training, engagement, management of special needs, looking at what their ratios are, looking at what their supports and amenities are. Do they have a hairdresser come in to do hair, or a barber, or whoever it is? Also, do they have hospice? Are they able to have hospice come into the facility to provide that hospice care to people? And then all of the other things, activities and meals, and what really is important to you as a family. And again, call us. You can set up an appointment to meet with a social worker virtually to talk through all of these things. And we've got some really great tips for you in terms of looking at kind of what let me just say what to look at to gain better information about the particular facility. And I'll give you two quick tips. One is Amy's, and she always says, when you either go to visit the facility, you arrive, or you're leaving, look for any families that are in the parking lot and have a quiet word with them to ask them how their experience has been. You want to do it in the parking lot and not in the facility, because you're going to probably get a more honest answer. So, and you don't want to put them on the spot when they're in the facility. For me, two of the things I always look at is when I'm touring, I want to see, for residents that wear glasses, as I do, are those glasses clean? Are the lenses clean? And if they aren't, I'm not happy about that. And also, I want to see how the staff are addressing residents the staff that is touring me around, how they're addressing residents as we walk on by. Are they saying, hi, I'm Mrs. Jones. Hi, how are you? You look great today. Or are they ignoring them? What's going on? So there's 2 tips, but if you want to know more, you have to call us.
Jean, if I could just add on that first point there, regarding its licensing status, I just wanted to add that the most recent inspection report these are publicly available documents, and Jean's going to share with you some resources here for where you can find them online. But you can also just request a copy of them when you're visiting a community. Don't be afraid to ask for it. It's always available.
Absolutely. They actually are required to keep a copy in a binder right at the front desk as you go in. And then you can also just do your own research at home. And so these are all really terrific websites. I would encourage you actually to take the time to go to each and every one of them. At the top is the California Advocates for Nursing Home Reform. We refer to this organization as CANNER, and it was a group of advocates who got this organization started to tighten up the requirements for licensing for nursing homes, and they were quite successful, and so they're a great organization to go to. The California Department of Social Services will give you information about those RCFEs. And so you can go there and to this website and find out about the memory care places, the assisted livings, the board and cares. The California Department of Public Health is where you will go for further information about skilled nursing facilities. A terrific local resource we have is Choose Well. And this is a website that is focused on assisted living facilities here in San Diego County, and good information in there as well too. And then of course, always contact us. We do have a list of local residential care facilities, dementia and memory care communities, and it does include board and cares as well too. And we've got it grouped geographically so that you can go to your geographic location that you are looking at and start there. And we've also got some great, more expanded checklists for evaluating memory care. And again, we can give you some of those tips that we have all learned over the years about things to look for when you are touring a facility. And so, Amy, I do believe you're up.
Yeah, great. So Jean did a really nice job of explaining the array of sort of options that exist when it comes to residential care. And again, we'll be pausing for questions here in just a little bit. So if you've got specific questions about any of those levels of care that Jean just described, please feel free, just write those in the Q&A, and we'll take those in a moment. But before we do that, I just want to introduce you to some sort of ancillary services that we find are often very helpful to people who are in the midst of making this decision. We know that the choices, the array of options that are available here in San Diego County, we're grateful for it. We're blessed to have so many options, but that wide range can actually feel a bit overwhelming at times. There's also just the sheer fact of my years sort of working as a care manager, working individually with families prior to my role here at Alzheimer San Diego. The biggest barrier I found, I mean, of course, there's the barrier of cost and how are we going to afford this? But the biggest emotional barrier, I think, or logistical barrier was the stuff. What are we going to do about our things, right? How is mom or dad or my spouse going to live without all these familiar, comfortable, the things around them that they're used to? And even if they could, it can just be hard to imagine getting rid of all of this stuff. So we just want you to know that help is out there. You're not alone if you're feeling that barrier, that obstacle, and it just feels like it's way too much, you're not alone in that. It's really common, and there are resources out there to help you with it. So first, on the topic of making a choice, of course, Jean has mentioned to you that we're available to, we maintain a list of the local memory care facility, dementia specific memory care assisted living communities and boarding cares here in San Diego County. Just reach out to us. Kristen has put the link out in the chat. Reach out to us anytime if you want a copy of that list. We organize it geographically. And you know, we know that each of the places on that list, their license is in good standing, but that's about the extent, right? We aren't going to tell you here, this is the place where you should move. We're certainly available to provide consultation to help you think through those options and help you make the choice about which is the right one. But there are times that, you know, there isn't local family that can be going out to make visits, or it's just not something that a care partner sort of has the bandwidth to do. Understood. There are professionals out there who can help you with this. They're sometimes referred to as referral agencies or placement agencies is the terminology we tend to use here, internal. These are professionals who can give you a set of recommendations for local residential care facilities that fit within your budget, right? They'll work with you to determine what you can afford, the geography of what's appropriate, the level of care that's appropriate, right? A good one is going to meet with you, and they may need to do that virtually these days, but they're gonna spend some time really getting to know you, doing an assessment and getting to know what your needs are so that they can make an appropriate set of referrals to you. They'll generally provide you with a few different options, and you know, so they operate in different ways, but some of them will take you on tours, some of them will just give you a list. Like kind of up to you. So the placement agencies are free to you as the client, as the user of these services. And we want you to be aware they're not free, right? They're getting paid. They are paid a referral by the communities that if you move in, then they get a fee for having made that referral. So, you know, you just want to ask about their practices, where they have contracts. And feel good about their process. There are many good providers of placement services out there here in San Diego County. And again, we're glad to point you toward those resources if you are in need of one. Senior Move Manager. This is a kind of a little known professional that we're big fans of at Alzheimer's San Diego. There is an organization called the National Association of Senior Move Managers. We've provided the link there on the screen for you so you can find out more about these folks and locate one. These services are not free. Individuals do pay out of pocket for the help of a senior move manager. They're a huge support to people who have that sort of barrier, are overwhelmed by the idea of moving, right? Packing up, deciding what to bring, packing things up, getting things settled into the new place, and then dealing with all that other stuff that's left behind. That's what these folks do. And it's really kind of, they work some serious miracles. They'll get the new apartment all set up with familiar, you know, the familiar chair and picture and you know, end table with their favorite, I don't know, ashtray. That's not the right. Trying to think of like the accessories that would be on the table. They'll create this lovely little vignette to make the new home feel familiar and welcoming to the person who's making that transition in. It's a really lovely service. Again, it is something that you pay for, but they will come out and do a consultation with you to let you know, right, based on what you need, here's what this would cost. Can be a really great help to people who it's just, you know, the idea of the pack and the move itself is too much of a barrier to making a decision about placement. Additionally, there are Sure, please.
Just that, you know, I mean, one of the great, I think, strengths of these move managers and organizers is then they can do the battle with the people about what to keep and
Right,
what to
right.
let go. And then it doesn't have to be you as a family member. So you don't have to engage in any arguments with parents or whoever it might be about, you know, the downsizing process. So,
Yes.
and that's worth its weight in gold. Trust me. I know.
Absolutely. I would say that's probably true about most of these services that we're talking about here. Having a third party who's a little more objective in their evaluation of what you need can often be really helpful in terms of kind of diffusing a lot of the emotions around this stuff. Also, just from a practical consideration, most of the senior move managers, many of the professional organizers, as well as the placement and referral agencies, they know these communities really well. They're familiar with the buildings and the administrators. And in the case of a senior move manager, they know the floor plans of the room. And so they can actually just come in. It's amazing. They can come in and help you visualize, no, you're not going to need this much furniture. You don't need to bring 20 tea towels with you, right? They can really help you kind of pare this down in a really logical way. Thank you, Jean. It's a great point. Just having a kind of an objective mediator is not quite the right word. That's a real thing, but you know, having an objective set of eyes to look at this situation can be a huge help to a lot of folks. So a professional organizer, these are senior move managers and organizers overlap in some ways, but they can really be helpful with regard to the sort of giving you advice and also providing practical help with getting organized and decluttering. So for a lot of people, it's that notion of downsizing, again, is just over. They know they need to do it. They know they need to declutter, but they don't quite know how to do that. Can be very helpful. So the National Association of Productivity and Organizing Professionals is a place where you can go to find a referral to a professional organizer. This, of course, is a service that you would pay for as well. And finally, an aging life care professional. This is another phrase that is used to describe a care manager. That is the work that I was describing that I did in my past life, and actually that Jean did as well. An aging life care professional is a private professional that a family or a client or an agent for power of attorney, for example, can hire to bring in to help a family kind of navigate these systems. They can provide help with making placement decisions, helping you, narrow down your choices and make a decision about where you or your loved one are going to move. They can coordinate the packing, the moving, the downsizing, right? Often working with these other professionals as well. So aging life care professionals, this is a private service, and so one would pay out of pocket as well for those services. They charge on an hourly basis usually rather than a project basis like these others. So you're typically looking at anywhere from, depending on where they are in the country, $100 to $200 an hour is pretty standard for the services of a care manager or an aging life care professional. So you can find one of those. Again, this is a service we can refer you to at Alzheimer's San Diego. We maintain a list of these folks here in San Diego County, but if you need one outside of San Diego County, you can find one at aginglifecare.org. So now we're going to pause for a moment and see what questions have come in. Kristen will ask you to guide us through this. Let us know what we can help with.
Hi, we have some fantastic questions actually. The first one, which I saved because I thought most people would enjoy knowing the answer to this, is what is the caregiver to resident ratio in a memory care facility?
Oh, it's a trick question. It's a really good question. Unfortunately, there is not like one standard answer to that. As Jean indicated, I don't know exactly how the language reads, but Jean summarized it well. There is no specific number that is required, either at a boarding care, in an assisted living, or in a memory care community. It's not like, you know, the state says you have to have 4 residents, 1 staff for every 4 residents, for example. What is required is that, given the sort of mix of people who live there, the number of residents, the types of care that they need, and the particulars of that particular group of people, you know, at any given time, an assisted living community or memory care community may have, say 20 residents, but they may all have very low levels of care needs at that time, in which case the community could have a much higher ratio of employees, you know, staff to residents, and still be able to take care of those folks safely. At other times, they may have a mix of residents who have much more intense care needs, who have a lot of sleep disturbance, a lot of behavioral issues, safety concerns, so it may take more staff. They may then, in those moments, be required to have a lower staff to resident ratio. So it really depends on the time of day. Often they'll have a much higher ratio overnight because more clients or more residents are sleeping. So it can change during the course of the day. It's really on the administrator or the director of nursing, sort of depends on the setup of the building, to make a determination about what is safe for this particular kind of cohort or group of residents. So there isn't a specific number I can give you. Jean, is there anything you'd add to
Nope,
that?
that's spot on.
Okay. Okay, but ask. It's a really good question to be asking. Just because there's not a correct answer doesn't mean that you shouldn't ask that question, right? When you're visiting, when you're touring, during the day, how many staff do you usually have on duty, and how about at night? And as you're visiting multiple communities, you'll get a feel for sort of how they compare to each other.
The next question we have here, and I'm going to make this one a little bit more broad.
Sure.
But what do we know about the differences in for-profit versus nonprofit facilities? And I guess how many nonprofit facilities are in the county?
I don't actually know the number. There are some. There are quite a few nonprofit entities that own and operate residential care facilities. I can think of a handful right off the top of my head, no more than maybe 4 or 5, but there's probably more than I'm just thinking of quickly. What is the difference? I mean, it's in terms of, you know, if you were to step into a for-profit versus a nonprofit lobby of an assisted living or memory care facility that was for-profit versus nonprofit, I don't imagine you'd see or be able to tell a huge amount of difference. The costs may be a bit lower, not significantly lower, but a bit lower. It's just their legal status, right? If they're owned and operated by a religious organization, they are usually religious organizations that own and operate the nonprofits. Then they're required to do different things with their revenues. You know, so it's more of a tax status than anything else. But many folks, because they are operated by religious organizations or other social service nonprofit organizations, it sort of feels better to be paying your fees to the nonprofit rather than to a for-profit corporation, and call it more of a personal decision, really, rather than a care related or a cost driven decision in most cases. Now, is there anything any difference that you're aware of, Jean?
I would agree with that. I mean, you know, it's just a matter of kind of personal preference. And, you know, I'll tell you, I worked for in memory care for a nonprofit organization for many years, and it was a good organization. But, you know, I mean, they still have the same challenges and the same successes as well too as other facilities. So I would say, I mean, if it's something that's really important to you, or if it's really important to you that you support, as Amy said, it's usually a religious organization, then go for it. If that part of it is less important to you, I would say focus more on the licensing survey reports and the, the quality of care.
When you're looking at reports or visiting a facility's website, there will be information on their website about who owns the building, and that is a good thing to be asking. Is this a privately held corporation? Is it do they own and operate many buildings across multiple regions, or is it a nonprofit? And again, there isn't a right answer, but it is a good thing to sort of take into account in your own decision making.
Agreed.
Anything else?
We have time for one more. This question is quite in depth, so I'm going to recommend that this person give us a call so we can discuss it in more depth, but one part of it might be helpful that everybody have an answer to, and that is in memory care facilities, do they typically allow a spouse to move in if that spouse does not have memory loss?
Oh, this is a really good question. And honestly, I'll say in my years of working in this field, I haven't yet come across a community that has really figured out how to do this. Generally, most of them would permit it. Not all of them. There are some that restrict that and would not allow it, but most of them would permit it. But in my experience in working with and being familiar with many of these memory care communities, it's generally not a good experience for the spouse who does not have dementia, and generally does not work out well. For a variety of reasons, social reasons, right? Conflict reasons, boundary reasons, but also financially, right? If they've got a second person living there, they've got some responsibilities to that person, whether they need the care or not. So I have seen several communities over the years try to sort of develop programming, creating spaces that are more welcoming to couples, because they realize, and we see it too, this is a real unmet need out there in the community. But I don't at the moment know of a community that's doing it with any great success. And if anyone does, I would welcome you to write that in the chat and share it with us. But I love this question, and I would love to see the industry kind of figure this out. But I don't think we've got a good solution for it yet.
Yeah, and I would agree with all of that too. It just, the way that it's been addressed and or attempted right now by facilities and by families has not been successful. Yeah,
it's a tough proposition, really, creating a community and a space that's suitable for such a wide array of cognitive and social stimulation needs. It's really tough. Yeah. Jean?
I'm sorry, am I up?
Yeah. Right.
Oh, I apologize. I thought.
Oh no, it's.
Yeah.
Is it me? Sorry,
I think
guys.
it is you.
Sorry. Sorry.
Is it
you? No wonder. Bear with us. Like we said, we're always trying to work it out. Okay, here we go. So now let's talk a bit about how we pay for long-term care. As I hope we made clear at the beginning of the program, long-term care is not healthcare, it is not medical care, and therefore it is not covered by Medicare and traditional forms of health insurance. So how exactly do people do this? Well, most of the time it's through, the liquidation of personal assets, pooling, savings, families sometimes have to come together to pool resources and pay for the cost of long-term care, whether that's in a home setting, if it's, bringing in community-based services, or especially in the case of residential placement, because as you heard, as Jean described, these are pretty expensive levels of care. Long-term care insurance is a terrific product if you have it, right? If you're attending this webinar right now because you or someone that you're caring for is living with Alzheimer's or another form of dementia, long-term procuring a new long-term care insurance policy is not an option. The policies are very expensive. They really are. Most people can only afford them when they're relatively young and relatively healthy. Once you've got a chronic condition such as dementia, a person would not be eligible to purchase a new policy. So I'll leave that I'll leave that there, but I will say that if you or someone that you're caring for has a long-term care insurance policy, get it out now. Have a look at it. I just was doing this last night with a family member's long-term care insurance policy, just getting familiar with it. And they're all written differently. They all have different exclusion criteria. Get familiar now with what benefits the person has and the claims process. So that you won't, what we've seen far too often is that people have long-term care insurance policies. They've been paying the premiums for years and years. And they just hold off too long in opening the claim, or their caregiver unfortunately didn't know that they had it. So just get that policy out now and get familiar with what's in it, and get in touch with an agent if you're not sure. They can always do a benefits review for you. There's no charge to have that done. There are some financial tools that are available for people who, many people in Southern California in particular, their major asset is a home. And if that's the case for you or the person that you're caring for, we just want you to be aware that there are some tools for getting money out of a home or out of an old and unused life insurance policy, for example. There are some resources for that. Each of these has its pros and its cons. So you need to talk with your accountant, a financial advisor, about whether or not these options make sense for you. But we just want to sort of say there are some tools out there. Reverse mortgages, not often a great option for people with dementia in particular, because they do require you to stay in the home. And many people with dementia, the home care will not be a feasible option in the very long term. So that's sort of a drawback there. Charitable gift annuities, where a home or other large asset can be gifted to a nonprofit organization who then pays out on an annual, pays an annuity so that you can use that income to help cover the costs of long-term care. Or again, one can convert a life insurance policy. If you don't need it anymore, you can convert it for a fee. Of course, there are big fees associated with all of these things. You can convert it into cash for using to cover the cost of long-term care. So those are options for people who have savings and other assets that are sort of tied up in other ways and need to make them available to cover the cost of long-term care. But what do you do if you don't have those assets? There is a safety net and there are some options. The Medicaid program called Medi-Cal here in California, and the VA does offer some long-term care specific benefits too. So we'll talk about those. First, I just want to quickly explain. I like to describe Medi-Cal in the context of it not being Medicare, right? You can have Medicare and Medi-Cal together, but they are two different programs. And because the words sound so similar, they often are confused. So Medicare is the federal health insurance program that anyone who worked enough quarters or who was married to someone who worked enough quarters paid out those Social Security deductions. Everybody is eligible for it. It's an entitlement program. It doesn't matter, at least as of right now, it's an entitlement program, and it's not based on your income, your assets, whether or not you need it, and it has nothing to do with your health status either. You can't be denied Medicare if you paid for it. So Medicare is health insurance. So again, want to emphasize, it doesn't cover the cost of long-term care. This is a big revelation and a bit of shocking news for a lot of people when they decide to hire in-home care or make a move into assisted living, and they don't find out until then that no, in fact, your Medicare is not going to help you cover these expenses. So it's for medical care, doctor's visits, hospital stays, skilled nursing facilities, those rehab stays in a skilled nursing facility, not the custodial long-term care stays, and home health care services. These are, the licensed nurses and therapists that come out to the home on a short-term basis to help you recover from an illness or an injury, for example, not the non-medical in-home care services. So that's Medicare. Medicaid is something different. So Medicare is a federal program. Medicaid is a joint federal and state program. It's operated, the funds come both from the federal and the state governments, but the states operate them. So every state has its own Medicaid program, its own eligibility and its own rules about who gets it and what it covers. So in California, we call it Medi-Cal rather than Medicaid. It has different names in different places. It is a needs-based program. Unlike Medicare, you don't get it just because you've paid into it. Medicaid, Medi-Cal is for people who need it. So what exactly do we mean by need, right? We tend to think about Medi-Cal as a program for low asset, low income individuals. And it does cover health insurance for low income individuals, but it also in California has some specific provisions related to long-term care. And these aren't just for low income individuals. This is really more of kind of a middle income kind of an asset protection program, if you will, developed to try to prevent people from becoming impoverished by the cost of long-term care. So if a person, so that is to say that individuals who are not necessarily low income can still qualify for Medi-Cal. There are asset requirements. You can't have an unlimited amount of money in the bank. You can have a home, you can have a car, you can have a retirement account. There are many assets that are considered exempt from the calculation of whether or not you're eligible for Medi-Cal. Your income can really be any amount, but if you have a higher monthly income, then the state will require you to pay what's called a share of cost. You won't get your Medi-Cal for free. You're gonna help the state pay for that. So I'm gonna leave it at that because this is a very big and complicated topic, and we have another webinar devoted to this subject that I'll point you toward here in a moment. But that's the basics of Medi-Cal. We just want to make it clear that more individuals are eligible for Medi-Cal than may be aware. But and that's the good news, right? But on the other hand, in California, you are limited in terms of what Medi-Cal helps you pay for. So when I said every state makes its own decisions, right, about what Medi-Cal does and does not cover. Here in California, if you are a Medi-Cal recipient, you can use Medi-Cal benefits to help cover the cost of what's called IHSS or in-home supportive services. This would be up to, a few hours a day, usually. I think the max is about 9 hours a day of professional or family assistance in home with those custodial care needs, those activities of daily living. This is not 24-hour home care provided by the agency of your choice, right? This is a more limited program, but it's a wonderful benefit that can help a lot of people who don't need 24/7 assistance to stay at home a bit longer. Community-based adult services, these are adult day programs. This was covered in the first webinar in this series, so I will not expand on that too much, but Medi-Cal does provide for the cost of adult day services. And then skilled nursing facilities. This is where most Medi-Cal dollars are spent in terms of long-term care here in California. If you are living with dementia or caring for somebody who's living with dementia and you are not able to stay at home, right? The in-home supportive services benefit is not enough to keep you safe and healthy and well in a private home environment, and you need to live in a residential setting. In all likelihood, the skilled nursing facility environment is where the person will end up. We do have something called the assisted living waiver program here in San Diego County. It does not really cover to any great extent the cost of, it's not something that most people who are living with dementia are eligible for because it's it's for traditional assisted living. And as Jean indicated, people that have a dementia diagnosis generally aren't eligible to move into a boarding care or an assisted living that does not have, that does not provide dementia specific services. So the assisted living waiver program is available to people who are on Medi-Cal who may be eligible to live in assisted living. If you want information about it, please reach out and let us know. We're happy to get it to you. But we want to just make sure that you're aware that most Medi-Cal, if you've got dementia, you need residential care, you need 24-hour care. That usually means moving into a skilled nursing facility, and then Medicare sort of foots the bill. So this is sort of the balance that the state of California has chosen to make, right? It's actually not that hard to be eligible for Medi-Cal. Many people are eligible for Medi-Cal, but your choices, right, are more limited in terms of where you can live and what it will cover. The Veterans Administration does have some limited benefits related to long-term care specifically. Most of us are pretty familiar with the VA as a provider of health insurance and medical services. And of course, if a person has a service-connected disability, the VA has lots of benefits available to those individuals. But do be aware that if a veteran or the surviving spouse of a veteran is living with dementia or other conditions that result in chronic long-term care needs, there are pension benefits available to them. There's one program in particular, a non-service connected pension program called the Aid in Attendance Program, that is available to veterans who served at least 90 days of active duty. They had to have been honorably discharged, and they had to have served during a time that we as a country were at war. At least one day in that 90-day window, we have to have been at war. Technically, they don't have to have gone to combat, right? This is, again, not a service-connected benefit. The Aid in Attendance pension will provide funds that people can use for various types of long-term care. Many people use this to help them afford the cost of assisted living or memory care fees. So the business office of the folks who work in the assisted living communities are often very savvy with this paperwork. They've helped a lot of people through it, but you can also get information about the Aid in Attendance program through your local VSO, the Veterans Service Organization near you. So if you're not already in touch with your Veterans Service Organization, we'd recommend that. Let us know. We can connect you. We can give you a list of the local VSOs here in San Diego and help you get connected with them to learn more about that. And then finally, the VA also offers a caregiver support program. You can get good information about this program at caregiver.va.gov. This covers an array of sort of supports and respite services for veterans who are caring for someone else. Adult day healthcare benefits, a homemaker, a home health aid program, as well as at times they can cover temporary, what are called respite stays, a temporary placement in a residential care community if a veteran caregiver needs a little bit of a break from their caregiving duties. So here is information about our legal and financial basics program. You can find, we offer it live, a live webinar recording. This is delivered by a local estate planning attorney. We have a group of wonderful volunteer attorneys who, they're not volunteer attorneys, they're attorneys who volunteer their time with us at Alzheimer's San Diego to provide this information. We do it every few months, but we have a recording of a recent webinar available in our webinar library, so you can view that anytime. And they dig in more on the VA benefits, the Medi-Cal program, how it works, and what it covers. And now I know it's Jean's turn.
And now it's me. Yeah, okay. So resources and support. Well, first of all, let's starting the conversation. Let's start there. And, as I've said throughout today's webinar, I do encourage you to contact us it can be really helpful to have a family meeting and have one of our social workers helping everybody to kind of come together and prioritize what are the items for discussion and review as we are starting this conversation. So for sure that means getting the right people to the table, and that's the decision makers. The power of attorney for healthcare is a decision maker in this process, but so is whoever is the power of attorney for the finances. And, hopefully it can be a family discussion, but sometimes that's hard to do. I'm not aware of any family that's perfect. If one of them is out there, I'd be happy to meet them and give them a shout out, but my family's certainly not perfect. We don't always agree on things, which is why it can be really helpful to have somebody objective that is there, that can be kind of bringing everyone to the table and getting focused on what are the really important things to be talking about. For sure, the most important thing I guess I want to communicate to all of you folks here at this moment, there's lots of important things, but the most important is don't wait. I cannot tell you, don't wait to have these talks, and don't wait to develop a plan, because I can't tell you how many times, and I know Amy's experienced this, and Kristen, and every member of our team back at Alzheimer's San Diego, we get a call, and I guarantee you it's Friday at 4 p.m. and a family member with dementia maybe has been hospitalized and now is being discharged, and the elderly caregiving spouse cannot manage anymore. And we need to find placement like right now, tonight, today. And it's an urgent situation, and it's very stressful, first of all, for families, stressful for everyone. It doesn't allow for that time to be thoughtful. And it's not a good situation. And we don't want any of you folks having to go through all that stress. So start exploring your options before the need is there, and start getting a plan in place. Of course, that means you have to assess finances and be clear about that. As I said in yesterday's webinar, budgets dictate what we are able to do. So we need to dial down on that and know exactly what there is to be spent on a monthly basis. And as best as we can to try and look into the crystal ball to look at how long we think we're going to need that. And that's hard for families. And again, that's an area we can help in, not that we have the crystal balls, but we can give you some of the ideas and resources and supports to help you come maybe to a more comfortable decision with regards to planning for how long this is going to go on. We do want to connect you to local resources as well too. So start doing these things, folks. Get on the phone to our organization and start looking at things. So when we're talking about placement, I like this slide because it really cuts to the chase, and truly, yes, prepare for resistance and disagreement. I would say probably a majority of people, I would just say, this is just my opinion, professionally, a majority of people really would prefer to stay in their home. We do sometimes have people say, yeah, no, I want to move into an assisted living, and I don't want, my family to have to fuss about things. But oftentimes the stated goal is I want to stay in my home for as long as possible. And to quote from a TED Talk, that's a stated goal, but that's not a plan. And so, if that is the plan, then you need to put a plan in place. And if plan A, to stay at home, is not going to work out, then have plan B also prepared and in place. So, and yes, be prepared for resistance and disagreement. You do need to consider with people with dementia, their own ability to have insight into, what their care needs are and how they're really doing. And we see this again often. Families are saying, you know, mom has been at home doing okay, and we brought in supports and she's been doing okay. But now it's starting to be a safety issue, safety risk for wandering and other safety issues. So she needs 24/7. And mom may still be in the frame of mind that she's doing okay on her own. And that's often the case. And we just need to be prepared for these situations and not let this be the barrier that stops us from planning. We still need to move forward with the plans, folks. So yes, you need to do your research and get organized. Access all these websites we've been talking about. Visit websites to see what's going on. And then, you know, where possible, again, pandemic has changed some things, but for you to be able to potentially visit a community or to speak with a placement service who has visited the community. It's really important when we're talking about this whole thing of residential placement, not only for the person living with dementia, but really I think with ourselves as care partners and as family members, to use positive language and action-oriented language rather than trying to negotiate about, you know, well, I'll give in on this if you do that kind of thing. Well, you know, I mentioned that I worked in a memory care facility for 10 years, and truly a majority of our folks were happy residents. And this can be a very positive event for everybody, but you kind of have to go into it with that mindset rather than with a negative mindset. And the other thing that I'm going to say here to all of you folks as family members is don't make promises you can't keep. And so if your family member is saying, don't ever place me in one of those facilities, you be careful how you respond to that, because I've seen family members who've had to go against their word and place their loved one and have really struggled with the guilt feelings over that. So if these are issues for you, and they are for many of our families, many of all of us, you call us and we'll help support you and help give you the guidance and the resources you need to do this and do this well. We have all sorts of tips for a smooth adjustment, meaning when you're moving your person with dementia into a facility. And I'm not going to go into too much detail with this. This could really actually almost be its own webinar. There's lots that can be done. But for sure, you know, work with the facility, work with their assessment process, with their staff. You need to establish relationships with these folks because you are a team now working together to care for the person, your person living with dementia. And absolutely meet and interact with other residents and care partners as you are able to, given the pandemic. I think there's just great strength and support and camaraderie to be found in forming some friendships. If I may say, I'll call them maybe facility friendships with other family members and residents that you will get to know over time and have some, you know, nice friendships and some affection for. Work with the staff to coordinate the actual move-in day. And they've done this. They're good at it. So put your trust and your faith in them. And have someone you can reach out to for support. And I'll tell you a quick story we had from, this is true and real, from a person we had at one of our classes way back in the day when we actually had in-person classes. And this lovely lady spoke up and said, Amy, you can chime in. I think she was actually planning on placing her husband. She was at a class that day and she had
already placed him.
Oh, she had already placed him. Okay. But it had just happened maybe a week before. And what she had done, which we thought was so fantastic, she of course worked with the staff, but she also had a circle of very good friends who were actually members of her support group that met her after she had dropped off her husband to live in the facility. And these friends and support group members just surrounded her, and they took her out for lunch and let her, they took on her emotions and let her just feel what she needed to feel, and they supported her. And that's really a fantastic way to do things. So for more information, as always, I'm sure you all get tired of hearing me say it, like, contact us. And as well, we've got, I might say myself, a really fantastic webinar library. And we've got this really terrific webinar that Amy and our CEO, Eugenia Welch, have do together, and it's called After the Move to Memory Care. And Eugenia was an administrator of a memory care facility for many years. So she's got some particular insights of her own, and it's a really terrific webinar that I encourage you to have a look at. This is us. Look at all the things we do. And so I'll do one more plug for it. In addition to all of these wonderful things that we do have family meetings and consults. And by the way, all of our programs are at no cost. So you can contact us and arrange for a family meeting, and there's not going to be any cost or charge associated with that. Of course, we do always appreciate your support of our organization as a local nonprofit.